Chelmsford as staggering at a time when public bodies are under such pressure to cut costs.
But the hospital has defended its decision, saying the art in its new wing will help patients and enhance the environment. Tom Barton reports.
What price art? At Broomfield Hospital in Chelmsford, the answer is £421,000. That's what's been spent buying pieces to decorate a new wing at the hospital, which is due to open in 2 weeks' time. This 9-foot-tall fiberglass and steel statue by artist Joseph Hillier is one of a pair. Apparently they're inspired by medical imaging and the minute cell structure of the human body. The question is whether £400,000 for art like this in a hospital is a tall order.
Hello, could you get me the next patient, please?
Dr John Cormack thinks it is. He's concerned his GP surgery in nearby South Woodham Ferrers could be under threat from government cuts.
I really don't think you should be spending money on things like this until you've sorted out the basics, the bread and butter stuff, what the health service should really be concentrating on. In this practice, I have to scrape to get by. Last month I had to pay in £2,500 of my own money to pay the staff.
It's quite clever, I think, because it gives a depth to the glass.
The hospital's currently trying to save £24 million from its annual budget. Its chief executive told me that because of the way this art is financed, it'll cost just £13,000 a year, and insisted the art plays an important part in helping to treat patients.
Given the fact that we know that art, architecture, green space, natural light together contribute to a healing environment that helps patients feel better, but also get better quicker and go home faster, that's a good investment.
A lot of people would say that seems like a lot of money.
I don't think it is, but I admit that the timing, given the current economic climate, is unfortunate. And if I was approached today and asked to spend £400,000 on art, I would of course say no.
For what the hospital's spent on art, it could have had one top-level consultant at £175,000, 2 junior consultants at £75,000 each, 3 nurses on around £25,000 and 1 junior midwife at £21,000, adding up to a grand total of £421,000.
What, 400 grand for art? That's ridiculous.
If it makes patients now feel more positive about their time, I suppose it's a good thing.
It's just a lot of money to spend, really, isn't it? I think it could be spent on something else.
Not all of the art in this new wing was expensive. These pieces were created by students from the nearby Chelmsford Valley High School. In a fortnight's time, the doors will open and the first patients will be treated in this £148 million building. Hospital bosses hope they will see the benefit and not just the cost of this artwork. Tom Barton, Anglia News, Chelmsford.
And you've been letting us know what you think about that story on our Facebook and Twitter pages.
Yes, thank you for getting involved. And you can join in the debate at facebook.com/ITV Anglia if you do want to have your say.
2 nursery nurses from Hertfordshire have been found guilty of cruelty towards a 2-year-old boy in their care.
Lisa Weimer and Rebecca Robbins had both denied mistreating the boy, claiming they were just playing with him. They'll be sentenced later. Well, Martin Stew has been at St Albans Crown Court for their trial, and he joins us now. Martin.
Yes, Lisa Weimer and Rebecca Robbins were entrusted to care for the 2-year-old boy. Instead, on the 17th of December last year, they bullied him and then laughed at him while he cried. The whole incident was captured on the nursery's own CCTV footage. Unfortunately, we can't name the nursery for legal reasons. Now, in charge of the toddler that day was Robbins, the 21-year-old from Cuddercott near Hitchin. When she told the toddler off for misbehaving, he began to cry. In a separate room, Weimer egged on the other children to poke the already distressed toddler. She then removed his shoes and socks, something she knew he hated, before dragging him across the floor by his legs. It was then that Robbins got back involved. She repeatedly pulled the toddler's trousers down, leaving him sobbing and covering his face. The jury, who was sitting at Magistrates' Court here because the Crown Court was full, found the 2 guilty of child cruelty. The judge, Martin Griffiths, said they'd acted disgracefully, although it was out of character. They'll be sentenced in 3 weeks' time.
Martin, there will be parents watching that have children in nurseries. Clearly a very distressing case, but we should say very rare.
Very rare indeed, Becky. According to Ofsted, there are 3,000 different nurseries, preschools and creches in our region. That means tens of thousands of us leave our children with strangers each year. Nonetheless, parents do worry, and one nursery in Suffolk has set about installing 8 webcams so parents can watch how their children are getting on from anywhere in the country. And it's a report that my colleague Natalie Gray has now.
Julie Chavou has no qualms about dropping her 2-year-old daughter Ruby at nursery. That's because she can check up on her anytime she wants to.
Hello, everybody.
It may sound a bit Big Brother, but Rendlesham Day Nursery in Suffolk has 8 webcams, 6 in the building and 2 in the garden. It means parents like Julie can view live images of their children over the internet from work, home or even overseas. Julie works as a complementary therapist from her home nearby and says stories about nursery nurses abusing or mistreating children fill her with dread.
You trust them with your most valuable possessions, basically, and it just makes you go cold at the thought that how anyone could do that to a child anyway, but even in a nursery setting, it's just unbelievable.
Happily, she's completely reassured by Rendlesham's "we've got nothing to hide" policy.
I remember when my oldest son first went to the nursery, and you're torn because, you know, you've got to go to work, but you've got that little backup there that you can check on them, I think up to 12 times a day.
Dan Powick is the nursery owner. He spent £3,000 on the webcams after watching a panorama documentary about nursery nurses abusing children.
And there was a lot of worry from parents at the time that we opened as to whether their children were safe at nurseries and how could they trust us. So it just seemed the obvious solution to us, and we think every nursery should have it. Parents can come in, they can log on from home, see their child playing safely, playing happily. Each parent has a username and a password, the same technology that banks would use, so they know they're perfectly secure.
The cameras are fixed to give a generic view of the room. They can't be panned, tilted or zoomed in to any particular child or member of staff.
All live images are encrypted before being sent through the internet and can only be securely accessed by bona fide parents with the correct password. And if their child isn't in nursery, they can't log on.
You've got 8 cameras following you about. Does it bother you?
No, it doesn't, not really at all. It just helps the parents reassure them through the day that their children are safe and happy, and it doesn't bother me at all.
I have no worries with the cameras. I'm used to working with them. I tend to forget that they're here most of the time, and we're just not worried because we have nothing to hide here.
Surprisingly, only a handful of childcare providers in our region offer this service. But the view here is that it's the only way parents can ever have total peace of mind. Natalie Gray, Anglia News, Rendlesham in Suffolk.